Welcome to my new hair now. I still prefer the blonde. And now I'm driving myself to the Piedmont Imaging Center. So here we are at the hospital, and my hair is being ultra crazy. But another reason I don't want to wear my wig on days like this is because you have to take all the metal off anyways. So there's no point in even trying. So I'm gonna go in and show you guys around, and then it's nothing to be afraid of. So here we are, walking through. I like Fayetteville. They have a nice imaging center. So that's where we're going now. But I think they have better equipment or something. Anyway, so I'm about to go check in, and we'll be back. So he got my ID, and now I'm just gonna sign because I checked in online, which makes everything much faster and easier for the people that work here.
And we're gonna do one signature. It's gonna be consent for treatment. This is
Okay.
gonna give us permission to do your test today, okay?
Okay.
And you'll sign there on the digital pad for me.
Okay.
Excellent. And then next, I'm gonna get you a VIP bracelet.
Okay. Yes, you get a VIP bracelet, and you get a lovely souvenir.
We're gonna do one big important part. Even though I verified who you are, I need you to double check for me and make sure I have your name and date of birth correct on here.
Okay, I'm not gonna show you guys my date of birth. Okay, yes, that's correct.
Perfect. And we're gonna go ahead and get this on your arm. And here's your VIP bracelet. Get you an all-access pass to the most expensive light show in Fayetteville.
Yes, all access pass.
Yes.
Thank you so
You're
much.
very welcome. It was a pleasure.
It was a pleasure meeting you too. Okay, so I talked to the tech, and he's allowing me to leave on my clothes, except I need to put a gown on front and back, and my wireless bra he didn't want on. So like I said, everywhere's different, but he's allowing me to leave my clothes on because I don't have anything metal. So you go into a room, and they give you a place to place your items, and then you put 2 gowns on, which I am doing right now. Here's how you work these things. First, you press C to lock it, and then enter a 4-digit code on the touchpad. So this is all my stuff, except for my phone, which I hope will let me go there. And then hit lock, and it locks your stuff in there. So I will be back in just a second. So as you see, after changing, you open the door, have a seat, and wait for the tech to come get you. Normally I would put a bobby pin in this right here because it's crazy, because you have crazy hair once you get cancer and it falls out and comes back. But it's not allowing me to even put it down. I even put wax on my hair this morning. I don't do anything. So you just have to deal with alfalfa for now.
Last name Maddie?
And like I said, I'm just sitting here waiting on the tech. Here's the little waiting room, and this is where I'll come back to get my stuff when I'm done with the MRI. It doesn't take very long.
So have you ever had a cat scan before?
And oh my goodness, do you love this? I think it's better straight. You know, you gotta make yourself laugh, because if you don't, things just get tougher. But if you can laugh your way through it, joke around, and if you believe in God. Yes. And now he's calling me back. Okay, now I'm in the room where I'm gonna get the injection for the contrast, and you don't feel it right away. They inject you, or they go ahead and put the IV in, and then once you get into the machine, they hook you up to the contrast, and then that's when they inject. And it makes, normally on CT scans, it makes you feel like you have to pee all over the place. It just warms you up. It makes you feel like you're peeing in your pants. But I can't remember MRI, but that noise you're hearing in the background, they are so loud. So that's why they give you something to put in your ears. So I usually choose the little styrofoam things, but they also usually have like musical listening devices and stuff. I just don't like listening to music because I'll probably start singing and then ruin the whole scan since it's of my brain. I'll forget, yeah, because I forget everything, like 2-second rebound. Okay.
If anything, if we're doing it right, it should just feel cool.
Okay.
Okay. And I'll do the majority of the pictures prior to giving it to you.
Okay.
I need your permission, however.
Okay.
Do you have any questions about the contrast?
No, I just asked him, and I just asked him, for you people that are watching, if it's like the CT scan and where it makes you feel like you burn all over, but it doesn't. So the MRI doesn't. That is a CT scan only.
But yeah, that's the iodinated contrast.
Mm-hmm.
People that have a sensitivity to shellfish, it's going to be a concern.
Mm-hmm.
This is, in addition to not making you feel like you're wetting yourself, it's tolerated better by your kidneys as well.
Yes, you guys heard him explain that. Okay. Okay, he's gonna explain things to me. And
that was my next question. Is there a
this
good
vein
spot right over here?
Yes, this vein right here. So my right vein is the best vein to go through, and that's what I've actually used the whole 12 years, which is amazing.
How much scar tissue's on that thing?
I don't know. Who knows?
I'm gonna have to get a running start to get it in you.
I don't think so. Everybody's done pretty good. Hang on. We'll video that so you guys see that it's not bad. Because we never know. God has that choice.
Who gave you that?
Oh, I did.
That bird that bit you?
No, I've been moving stuff at my mother's house, and I'm on Eliquis.
Oh, okay. Never mind.
So I'm a bleeder.
Yeah. So we'll blow.
Yeah, that's another thing. Make sure you tell whoever's doing your injection that you're on a blood thinner if you are, so they know that the blood won't squirt in their face and they can cover it up real quick.
Not only that, but I have a tendency at times to just kind of quickly wrap it with gauze.
Yeah. And I usually
not apply enough pressure, and then I've had patients get up. And, there's a trail of blood behind it.
Oh yeah, I usually take over, apply the pressure, and lift it above my heart.
Well, that's even better. So I appreciate knowing this going into it, so we won't make a mess and I won't have to clean the floors.
That's when you take it out. So here's the needle going in.
There's the scar tissue.
Yeah, see, I don't know what it looks like, but he does.
Well, you see how it's not threading?
Mm-hmm. Oh, yeah.
But for our purposes, it's gonna work.
It's gonna work, see? That vein is a winner. I tried to explain that to
I'm a liar. There we go.
Some ambulance drivers before. They wouldn't listen, and they blew out 4 veins.
Yeah. This one, you had to finesse it a little.
He had to finesse it.
But we're there. We're in there.
Yay.
And I'm going to hand push it.
Okay.
So I'm already aware that I may have to finesse it a little, but we shouldn't have any trouble going forward.
So what he just put in was saline, and that just makes sure that it's going into the vein and not into the random arm.
Yeah, we don't want that.
Yeah, we don't want that. So, and this bruise is because I'm on blood thinners and I'm helping my mom move stuff, and I bruise like crazy. So, with the MRIs, like I said, you have to take all of the metal off that you have because it will suck everything up in there. So therefore, we can't get the phone close to the MRI machine itself. But we can take pictures. So we're gonna do that so you see what it looks like when I'm going in and what the machine looks like and the process that is gonna happen. So stick with me and I'll be right back. All right, so we're going in
This
here
is the room,
to
so this is
see-
where I'll be working from.
Yes, and that's where I'll be laying. And it's not scary. You just need to close your eyes, go to that happy place or listen to some music. And they'll take a few pictures, and the MRIs are very loud. CT scans are a whole different story, and we will go over that in another video. But they are gonna take pictures of what I look like going in and what I look like coming out. Because they're awesome here. Thanks.
Well, so that's when the magnetic field gets stronger, and I would hate for anything to happen to your phone.
Okay.
It may not snap out of your hand, likely it wouldn't, but it may damage the brain of it, so let's not do that.
Yes.
So there's this, you can show, so that's going to go over your head.
Okay.
You'll be in there, and I'll take a picture of you once you're seated in with your mask on, okay?
Okay. And so, like he said, I can't go past the red line because we don't want to damage my phone, get it sucked up in there. Like I said, that's why you take all your jewelry and everything off. And I've got some headphones to put in my ears, so it's not so loud. I choose headphones, other people choose music, it doesn't matter.
minutes,
23 minutes.
give or take.
Give or take 2 minutes. That's what we're gonna say.
Exactly.
And so I'm going back in here to change. And
Do you remember which one you're in?
I don't remember. I think
Did you
it was
lock it
that
up?
one. I locked it. It's that bottom one. I got it.
You remember your number?
Yes.
Okay. Best of luck. I love what you're doing.
Thank
Take
you.
care, okay?
One more thing. So I'm all done. That took about 25 minutes, I guess. Awesome techs here. They were really cool to let me film as much as they did. And like I said, it's only 25 minutes. I just close my eyes and keep my little things in and think about what I'm gonna do after. And I think the first thing is to get something to do this hair. All right, I will see you guys in a few. Peace. Okay, I, as a patient, have totally underestimated how much the caregivers do for us.